Welcome, curious minds, to another deep dive.
Great to be here.
Today, we're embarking on quite an incredible journey. We're getting into the heart of a feline mystery, decoding cat pregnancy and labor.
Hmm.
And this deep dive, it isn't just about listing facts. We really want to arm you with practical, insightful knowledge.
Yeah,
The
absolutely.
idea is to help you become an informed cat parent, to be, ready to support your cat through every stage.
And that's exactly the mission, right? Understanding these signs, which can be really subtle sometimes.
Right.
It's not just fascinating, though it is. It's actually crucial for ensuring a safe, smooth delivery for mom and the kittens.
Okay.
So yeah, we'll cover what to expect, the different stages, but also, really importantly, those critical moments when you absolutely need to call a vet. We want you to feel confident.
Definitely. So it's like this journey of tiny miracles unfolding.
It really is.
A cat's pregnancy is, well, it's pretty short compared to humans, but
Mm.
it's incredibly transformative, typically around 63 days.
Yeah, that's the average. Give or take a few days, so maybe 58 to 67 days is the usual range.
Okay, so let's chart this course. Let's unpack it.
And what's really fascinating is how the cat's body and her behavior change across these weeks. It gives us these little clues, almost like a secret timeline unfolding.
So early on, let's say weeks 2 to 4,
Hmm.
what are those first whispers? What might you actually notice?
Well, probably the most common or maybe the most noticeable early sign is a change in the nipples.
Ah,
They can get larger, and they turn this very distinct pink color. It's called pinking up.
beeping up, right?
Yeah, and you usually see that around 2 to 3 weeks after mating. It's one of the first visible signs that things are changing internally. More blood flow, getting ready for lactation down the line.
It's really early. So what about appetite then? I'd assume it increases.
Mostly, yes. They definitely need more nutrients as the kittens start developing, but interestingly,
Yeah.
some cats actually have a brief dip in appetite first, maybe for a day or two. Some even seem to get a bit of like morning sickness.
Oh, really?
Yeah.
Like humans. Why is that? Hormones.
Exactly. It's primarily hormonal. That surge can cause a bit of temporary nausea for some, but usually the need for more food takes over pretty quickly.
And personality. Can that change too?
Oh, definitely. It varies a lot. Some cats become super affectionate, really clingy, like they're seeking comfort.
Ah.
Others might get quieter, sleep more, or even become a little bit irritable. Again, hormones are playing a big role. And by week 3 or 4, you might start noticing a little weight gain, maybe a hint of swelling in her abdomen.
Okay, so fast forward a bit. Weeks 5 to 6. Things are probably getting more obvious by then.
Oh, absolutely. Much more apparent. Her belly will be visibly swelling. You can't miss it. And her appetite usually ramps up significantly then.
Right.
This is also often when you might actually start to see or even gently feel the kittens moving inside, which is always pretty amazing.
I bet. Okay, so now we're hitting the final stretch. Weeks 7 to 8. The countdown is really on.
Yes, the impending arrival feels much closer. That fetal movement will be even more noticeable, stronger.
Okay.
The mammary glands develop significantly. You might even see her start producing a little bit of colostrum.
Colostrum. That's the really important first milk, right? With antibodies.
Exactly. It's packed with them. Crucial for the kitten's immunity right after birth. It's like nature's first vaccine.
Wow.
And you'll likely see her activity levels decrease. She's conserving energy for the big event. And this is also when that crucial nesting behavior really starts to kick in.
Okay, nesting. We'll
Yeah.
definitely come back to that. So we've tracked the growth, but as the big day gets really close, she starts sending out more specific signals, right? Like her body knows.
Yes, absolutely. There are specific physiological signs that tell you labor is imminent. We're talking, the last few hours to maybe a day or two before kittens arrive.
So what are those key physiological tells? What should people be actively looking for?
Understanding these is critical. They're the body's countdown clock, essentially.
And the most important one is,
The temperature drop, that's probably the most reliable indicator if you can measure it.
okay, explain that. How much does it drop?
Right. So a cat's normal temperature is usually somewhere between 100 and 102 degrees Fahrenheit.
Mm-hmm.
In the 12 to 24 hours before labor starts, her temperature will subtly drop, usually by about 1 to 2 degrees. It often falls just below 100 Fahrenheit, maybe around 99.
Just a degree or two. That sounds easy to miss.
It is subtle, yeah. It's not a huge plunge. It's thought to be linked to a drop in progesterone, the hormone that maintains pregnancy, which then allows contractions to start. It's her body recalibrating.
Okay, but measuring it.
Right.
Rectal thermometers aren't always popular with cats.
No, they are not. That's a very good point. While rectal is most accurate if your cat gets really stressed by it, that stress can actually affect her temperature reading anyway.
Right.
So maybe try once calmly, but if it's a struggle, focus more on the combination of other signs. Don't rely solely on temperature if it's causing distress. Look at the whole picture.
Good advice. Okay, besides temperature, what else physically changes right before labor?
Appetite again. Often there's a really noticeable decrease. Or she might just refuse food altogether.
Okay,
This usually happens maybe a day or even just hours before labor, probably because the enlarged uterus is pressing on her stomach, just not much room left.
makes sense.
Although it's worth saying, some cats will keep eating right up until delivery, so like many things, it's not 100% universal.
Right. And her mammary glands. More changes there.
Yeah, they'll likely become even more swollen, quite full looking, and some cats might start leaking a little bit of milk a few days or hours beforehand. Others only start producing milk right after the kittens are born.
What about any discharge? Is that normal?
Yes, potentially. You might see a clear, maybe milky or slightly yellowish mucus-like fluid from the birth canal. That's normal preparation.
Okay.
And then closer to the event, sometimes a brownish, sort of jelly-like thing called the mucus plug might be expelled. That means the cervix is opening up.
Ah, okay. That's a definite sign then.
It is. Once that mucus plug drops, or if her water breaks, the amniotic sac ruptures, then kittens usually arrive within about 24 hours.
So mucus plug, water breaking.
Mm-hmm.
What's the absolute sign that labor, active labor, has started?
That would be visible contractions, no mistaking those. You'll see her abdomen actively tensing, moving inward and outward as she starts pushing.
Got it. Okay, so those are the physical body signs. But cats also act differently, right? Behavioral cues.
Oh, absolutely. And these are just as important. They're instinctual, preparations for birth and for caring for the kittens. They give us really clear signals.
You mentioned nesting earlier. That's a big one.
Huge. It's often one of the most obvious behavioral shifts. She'll start actively looking for or trying to create a birthing spot.
What kind of spot?
Somewhere safe, hidden, quiet, comfortable. Think corners, closets, under the bed, maybe a laundry basket, even just a cardboard box.
So as the human, we can help with that.
Yes, definitely. Prepare a birthing box, maybe a cardboard box lined with soft, clean towels or blankets. Put it in a quiet, low-traffic area a few days before her due date.
But don't force her to use it.
Exactly. Offer it, make it appealing, but let her choose. Cats have their own ideas about safety.
Yeah, that sounds about right for a cat. What if she picks, like, the middle of your bed or your favorite jumper in the closet instead of the perfect box you made?
That happens. It really does. The key is flexibility. You offer the ideal spot, but if she firmly chooses somewhere else, you try to make that spot work.
How?
Make it as clean and safe as possible. Maybe move some clean towels to her chosen spot. Gently encourage her towards the box, but if she's adamant, work with her. Her feeling secure is the priority. Sometimes a clean towel in the wrong spot is the best compromise.
Okay, that makes sense. What other behaviors might we see? Grooming.
Yes, often excessive grooming. She might lick her abdomen, her mammary glands, and especially her genital area quite frequently.
Why does she do that?
It helps clean the area, preparing the birth canal, but it's also thought that the licking can actually help stimulate labor contractions. Sometimes they lick so much they create little bald patches.
Interesting. And her general mood?
Restless?
Very possibly. Restlessness, anxiety,
Mm-hmm.
pacing back and forth, changing positions constantly, seeming like she just can't get comfortable.
And maybe noisier.
Yeah,
Oh.
that discomfort can definitely lead to more vocalization. She might meow more, purr loudly, maybe even make low growling sounds or howl a bit. It's all part of the process.
Okay, now here's one I find interesting. Some cats hide, others get clingy. Why the difference?
It's a real contradiction, isn't it? And it really highlights how individual they are. Many cats absolutely follow that instinct to find a hidden private place. They want to be left alone.
Right.
But others do the complete opposite. They become incredibly clingy, follow you everywhere, almost giving you this look like, I need you here.
So they want support. Exactly. They seem to seek emotional support during this vulnerable time. But then again, hormonal shifts can also make some cats more irritable or distant than usual. So you really have to read your cat's specific cues.
Okay. Any other little behavioral quirks to watch for?
Yeah, a couple more. Her breathing might become faster, more rapid. She might even pant, a bit like a dog.
Panting, okay.
And sometimes changes in bathroom habits, more frequent urination or defecation, maybe even a bit of diarrhea. And you might see her digging a lot in her litter box, almost like nesting behavior there too. It's all linked to the pressure in the body preparing.
Okay, so labor starts. Contractions are happening. It's a natural process. But knowing the typical timeline, that probably helps ease the owner's mind, right?
It definitely does. So the big question is, how long does this usually take? And what's the typical time between kittens?
Yeah, exactly.
Well, the interval between kittens arriving can vary quite a bit. Usually it's somewhere between 10 minutes and an hour. Maybe 30 to 60 minutes is a good average to keep in mind.
Okay, 10 to 60 minutes between them. And the
Or
whole process?
the entire birth from the first kitten to the last can take anywhere from, say, 2 to 6 hours typically. But it can sometimes go longer, even beyond 12 hours, especially if it's a large litter.
Wow, okay. So patience is needed,
hmm
and the mother cat, she usually knows what to do right after a kitten's born.
Instinct is incredibly powerful here. Yes. Typically, after each kitten arrives, the mother will bite through the umbilical cord herself.
Okay.
Then she'll start licking the newborn vigorously. This cleans it, but crucially, it stimulates breathing.
Right.
She'll also expel the placenta for each kitten, and it's completely normal, though maybe a bit surprising to us, for her to eat the placentas.
Eat them. Why?
It's believed to help replenish nutrients and maybe hormones lost during birth. It also helps keep the nesting area clean. It's a natural, beneficial behavior.
Fascinating. So if mom knows what to do, what's our role? The human observer.
Your main job is mostly observation. Be a calm, quiet presence, supportive but distant.
So minimal intervention.
Precisely. Have that birthing box ready in a quiet spot, like we discussed. Watch from a distance. Avoid constant hovering, touching, or interfering unless you genuinely see a problem.
And definitely don't try to help by pulling.
Absolutely not. Never try to forcibly pull out a kitten. You could cause serious injury to both the kitten and the mother.
Okay? What if a kitten is born and mom doesn't seem to be cleaning it or it's not breathing well?
Okay, that's a situation where you might need to step in gently. If she ignores it, you can quickly and gently dry the kitten with a clean, soft towel. Rubbing it gently can help stimulate breathing. But give the mother a chance first. Sometimes she's just catching her breath before attending to the newborn.
Got it. Give her a moment, then gentle intervention if needed. Okay, so knowing what's normal is crucial, but just as vital is knowing the red flags, the emergencies.
Yes. This is where observation shifts into action. Knowing when to call the vet immediately is critical.
So what constitutes an emergency during labor? Let's start with timing, if things seem stalled.
Right. Time is definitely a factor.
Yeah.
If your cat is actively straining, really pushing hard for more than 30 minutes and no kitten comes out.
Call the vet.
Yes, immediately. Or if there's a pause of more than, say, 2 hours between kittens and you know there are more inside, that's also a concern.
Okay, what else?
If the whole birthing process drags on for more than 24 hours, or even before labor starts, if she goes past 67 days pregnant without any signs of labor beginning, that needs a vet check urgently.
What about discharge during labor? You said some is normal. When is it not normal?
Any large amount of bright red blood is an emergency. Also, any discharge that's green before the first kitten is born, or discharge that looks like pus or smells really foul.
Green discharge, why is that bad?
Greenish discharge is associated with placental separation. Seeing it before a kitten arrives could mean a kitten is in distress. Also, brownish discharge without a kitten appearing soon after is another reason to call.
Okay, and the mother's condition. What signs in her are emergencies?
If she seems extremely weak, lethargic, has difficulty breathing, feels very cold, low body temperature, is bleeding heavily from her vulva, vomiting excessively, or just seems really off or distressed, any of those warrant an immediate vet call.
What about the kittens themselves once they're born?
If a kitten is born and it's not breathing or seems very limp, weak, or feels cold, you should contact your vet right away for advice on what to do. Sometimes they can guide you through resuscitation efforts or tell you to bring them in.
And what if the mother just rejects the kittens, doesn't nurse or clean them?
That's also a reason for an urgent vet consultation. There might be an underlying issue with the mother, or the kittens might need immediate supportive care, like hand feeding.
Okay, one last emergency check. The placentas. You said she eats them, but we need to make sure they all come out.
Yes, it's really important to try and keep count. There should be one placenta for each kitten. If you suspect one or more placentas haven't been expelled after all the kittens are born, that's called a retained placenta.
And that's bad.
It can lead to a serious uterine infection, metritis. So if you think not all placentas have passed within, say, 4-6 hours of the last kitten, you need to contact your vet.
Wow. Okay, lots to watch for, but super important information.
Hmm.
We focused heavily on labor, But care throughout the whole pregnancy is vital too, right?
Oh, absolutely. Knowledge is great, but applying it is key. Proper care during the entire 63 days makes a huge difference for the health of both the mother and her kittens. It sets the stage for a successful birth and healthy offspring.
Makes sense. So let's talk about that holistic care. Nutrition must be top of the list. How do her needs change?
Dramatically. Nutrition is paramount.
Hmm.
From about the fourth week of pregnancy onwards, you really should switch her onto a speller food.
Like what?
A high-quality commercial kitten food, or one specifically labeled for pregnancy and lactation. These are higher in calories, protein, and essential nutrients needed for fetal development, and later, milk production.
Okay, kitten or pregnancy formula from week 4. And how much?
Her needs increase significantly, especially in the later stages. It's often best to offer smaller meals more frequently, maybe 3 or 4 times a day.
Why smaller meals?
Because later in pregnancy, the enlarged uterus takes up a lot of abdominal space, pressing on her stomach. She might not be able to eat large amounts comfortably at one time.
Ah, okay. And water.
Always, always ensure constant access to fresh, clean drinking water. Hydration is critical. And talk to your vet about supplements.
Like vitamins?
Maybe. Things like taurine, folic acid, vitamin E can be important, but a good pregnancy diet should cover most needs. The vet can assess if your cat needs anything extra. Definitely avoid giving her human food or snacks. They're not balanced for her needs, especially now.
Got it. Okay, besides food, what about her environment? You mentioned the nesting box, but general atmosphere.
Creating a calm, stress-free sanctuary is really important. Minimize stress triggers. Avoid loud noises, sudden changes startling her. Don't encourage really vigorous play or exercise, especially later on.
And other pets.
Good point. If you have other pets, particularly dogs or maybe even unneutered male cats, well, male cats can sometimes pose a threat to newborns, so consider giving the pregnant cat her own separate, quiet space, especially in mid to late pregnancy and after birth.
A safe room, basic room.
Exactly. Keep her main environment clean, well ventilated. And try to avoid excessive handling or picking her up, particularly in the last week or two. Let her have her space and feel secure.
Makes sense. What about vet checkups during the pregnancy itself?
Oh, regular vet visits are your best friend here. Even if she seems perfectly fine, they're crucial.
When should they happen?
Typically, the first checkup might be around 3 weeks after mating. The vet can sometimes confirm pregnancy then, maybe with an ultrasound to see heartbeats and get an idea of litter size.
All right.
Then maybe another checkup around 5 or 6 weeks to monitor fetal development. Later in pregnancy, maybe after day 45, an X-ray can be done.
An X-ray, is that safe?
Generally considered safe late in pregnancy. Unlike ultrasound, X-rays show the fetal skeletons, so it gives a much more accurate count of how many kittens to expect. Knowing the number helps you know when labor is truly finished.
That's useful for the placenta count, too.
Exactly. And a final check, maybe around week 8, can help assess the kitten's positions and make sure everything looks okay for a natural birth.
Good plan. Okay, are there any specific things we should absolutely avoid doing during pregnancy? Any don'ts?
Yes, a few key ones. Generally, it's best to avoid bathing your cat during pregnancy, especially late term. It can be stressful and potentially induce contractions.
Okay, no baths. What else?
Avoid routine deworming or vaccinations unless your vet specifically recommends it using a product known to be safe during pregnancy. Some common medications can harm the developing fetuses. Always consult the vet first.
Right, vet is key.
And just reiterate, keep an eye out for those warning signs we talked about earlier, even during the pregnancy. Things like sudden loss of appetite that lasts more than a day or two, any abnormal discharge or unusual swelling, call the vet. Don't wait.
Okay, that's a really comprehensive picture. So
Yeah.
pulling this all together, what's the main takeaway for someone listening who might have a pregnant cat now or in the future?
I think the main thing is knowledge empowers you.
Right.
We've covered a lot, from those very first subtle signs like pinking up, through all the stages, the behaviors, the labor process, and crucially, those emergency red flags. This deep dive gives you a roadmap.
A roadmap to being prepared, basically.
Yep, exactly. Being informed helps you stay calm, be confident, and know when to just observe and when to step in or seek help. Understanding these signs isn't just practical. It genuinely helps ensure the well-being of your cat and her kittens. And honestly, it deepens that bond you have with her. You become more attuned.
That's a great way to put it. And as we wrap up, here's something to maybe mull over. We've talked intensely about cat cues. But how might recognizing these kinds of subtle shifts in behavior in physiology, not just in cats, but maybe across the animal kingdom, change how we see the natural world around us.
That's a fascinating thought. How could applying this kind of observational skill, this practice of really seeing what's happening, empower you in other parts of your life? How do we transform just knowing information into, genuine insight and understanding?
Something to think about. Thank you so much for sharing all this incredible expertise today.
My pleasure. It's an amazing topic.
And thank you all for joining us on this deep dive.